Let's have an open, very candid, very collaborative conversation on what happens when we just scratch the surface. And I've seen it time and time again. I've seen it in a traditional, conventional setting, and I've even seen it in holistic integrative. And what I mean by that is we're literally only scratching the surface when it comes to your pet's health. Now, sometimes that comes from innocently being naive. Sometimes it comes from innocently not having all of the information. And sometimes I think, and I do think it's all innocent. The other side of that, I think it's innocent on, well, I just know that my pet doesn't have X, Y, and Z. I just know my pet is not dealing with X, Y, and Z. And I hope that that is the case. And my response is, but how do you know? And the reason I'm saying that is I've had pet parents that I've seen in a traditional conventional setting, in a hospital setting, maybe me as a relief travel veterinarian, or when I was an associate, that when we're diagnosing kidney disease or diabetes or cancer, I'd say 7 out of 10 times, if not 8 out of 10 times, the pet parents, that was not on their radar. They're shocked. That was not a guess. Now, the other remaining part of that, clients are like, I had a feeling, or I've dealt with this with a previous pet. And as soon as I saw something wrong, I came in. And when we just scratch the surface, what happens is we delay the destination. Sometimes we can still get to the destination if we're really, really fortunate. And sometimes it is a matter of luck. But oftentimes is a factor in this. And sometimes we get really, really lucky when we just scratch the surface and we're like, okay, something isn't right here. Let's dig deeper. And we're able to dig deeper. However, what I've seen happen time and time again with pet parents, especially that are coming to me for a root cause minded approach, a functional approach. And this is the pet parents, I don't feel aligned with Apoquel use. It's not working for my pet. I don't want my pet on a prescription for the rest of their life. They're 4 years old. Or I'm already starting to see it's not working like it used to. And we meet, we discuss possible options, we discuss the recommendations and why these recommendations are, why we want to explore intolerances to remove them from the pet's environment or nutrition to help calm down the immune system and not expose things that are causing inflammation. By looking at the gut health and seeing where is the majority of their immune system, where is their gut? Are they in a dysbiotic state, meaning they are very imbalanced? Do we have the right number of bacteria? Are they evenly distributed? How are we utilizing fiber? Do we have any pathogenic bad bacteria? Do we have too much yeast in the gut? And that's what's driving all of this. We look at toxins like glyphosate. We look at toxins like mycotoxins, the toxic compounds from certain mold species. We look at heavy metals. We look at minerals. And I have clients be like, I know that they don't have glyphosate. And I hope that that's the case. But how do you know? These are invisible things. You don't know. There's no way of knowing. And I wish that I had a crystal ball that I could be like, hey, based on your environment and what you're telling me, and me looking around, I think that we should only test for mycotoxins and microbiome because everything else is going to be normal. How simple would that be? Man, my job would be incredibly simple. In fact, I'd be like, well, this is what we need to do. We don't even need a test. Let's just get right to it. Let's just hop on that pony and let's just ride. But that's not the case. And so I see pet parents that are wanting to address the chronic poop issues, that are wanting to address the chronic allergies, but they're still only scratching the surface. And I get it. It is an investment. And the way I look at it is you're going to invest the time and the money anyways. It is just a matter of, can we do this from a proactive, calm state? We can gather the data so that we can make the decisions. Or are we going to have to be even more reactory? I don't even think that's a word. Are we going to even have to react even more? And now we're coming from a place of time is ticking, I'm still dealing with X, Y, and Z. I've had pet parents do that. We meet, they're lovely, they're bought into some of the tests, and I discuss and I'm like, hey, I don't know what tests are going to be abnormal. And if you only feel aligned with doing X, Y, and Z right now, just know that I'm probably still going to recommend the other tests. whether these tests are normal or not. And the reason is, if the test results we get back are not terribly abnormal, there's something driving this issue with your pet's health, which means we need to keep digging. And even if these tests are abnormal, it doesn't mean that other things aren't abnormal. So really, we're delaying getting to the destination. And I don't know about you, but when I'm going to a destination, I just want to get there. I really just want to get and cut to the chase. And I get for some pet parents, there's different reasons for just scratching the surface. However, when we just scratch the surface, we are losing time on getting whatever it is better that you want better. That is possibly relying on medications that you just don't feel aligned with right now. And sometimes we do need to lean on those medications. But I've had several pet parents scratch the surface. Things aren't getting better. We've had several follow-ups and they're like, I don't understand. And I'm like, because we don't have all of the data right now. Is it possible these tests come back normal? Absolutely. Unfortunately, there's no way I know this. What I can tell you is that without this data, we are going to hit a roadblock on how we can make decisions because we don't have all of the information. This can go through even follow through when we have all the information and following through with the recommendations. That if your pet, based on their results and me looking at it from a wide angle lens and looking at all the information and looking at why we connected, and then if they're needing restorative fecal microbiome therapy, basically we need to reestablish their gut microbiome. We need to get it back to a nice harmonious level. We need to remove the toxins. If we're not moving forward with that and we're still dealing with ear issues or the poop that just isn't quite normal, or we're scratching like crazy, that is why we haven't made any headway. We've got the data to make the decisions, but we haven't implemented the decisions. And so when we only scratch the surface, we're only going to get surface level results. And I know that may sting just a little bit. But if we're only doing wellness blood work on your pet, which is very valuable, it is, but you're wanting to make sure, you're like, I want to know they're as healthy as possible. That's where functional tests come in, because I have tested numerous dogs and I have been surprised on so many levels. I have had patients with cancer that I was pretty convinced, and this is why we test, because there's no way of knowing, that I was like, this dog's going to have glyphosate. This is what's driving the cancer. No glyphosate in the system. I'm like, okay, that's not it. I've had dogs come to me with chronic allergy issues that are eating highly processed food that they've been eating for a very long time. Their gut microbiome isn't that off, but they have glyphosate and mycotoxins in their system. And I'm like, whoa. Wouldn't have expected that. I would have expected the gut to be off. The gut just hasn't caught up yet. And it's very possible when we start detoxing, that gut ecosystem is going to collapse. And so it'd be very easy to just test the gut microbiome and be like, oh, it's not that bad. There's nothing else going on in this dog, when really there could be. There is no unfortunate, if it is X, it is this. If it is Y, it is this. If it is Z, it's this. That's just not the reality of it. And I've had test results after test results where I'm like, wow, I wouldn't have expected that. But now that we have that data, we can make this decision. I've had dogs under the age of 2 years old have extremely high levels of glyphosate in them. And they're barely 2 years old. If these levels stay like this, I have a hard time being convinced this dog is going to live a long, healthy life and not be at the vet with chronic issues and eventually possibly not even have cancer. I have a really hard time believing that. And so when we just scratch the surface, if you live near a golf course, if it is in your community and you're within a mile of a golf course, I think it is a due diligence to be screening your dog for glyphosate. We know for humans that the risk for herbicide exposure and glyphosate and conditions like Parkinson's goes up dramatically because of the wind carrying of these chemicals. I don't know about you, but most golf courses I've seen are pristine. They're gorgeous. Their grounds are kept very, very well. And so those grounds are kept that way because of chemicals that are being used. Yes, they probably have a very beautiful lawn crew that stays on top of mowing and edging and weeding, but that doesn't happen without the use of chemicals. And so if you live within a mile of a golf course, whether your pet is sick or not, but especially if your pet is dealing with issues with their skin, with their coat, with their ears, with their poop, with their weight, with inflammation, I would be screening this dog for glyphosate. And it's something I probably would do every 6 to 12 months. I would absolutely be screening my dog for mycotoxins. And I think all of this can be applied if your dog is presumed healthy. In fact, just today, I got off a consultation with a beautiful pet parent who is getting an 8-week-old puppy, and she wants to do everything right from the beginning, which I think is so profound. And I wish that more people did that rather than waiting. Be like, oh, they're healthy, they're young, maybe when they're 2 or 3 years old. And that is the very reason to start now, is to have that beautiful foundation from them. And there's some stuff we can't control, and we can still do everything right, and things sometimes don't end up in our favor. And that is when it's hard. Also, at the same time, we can say, I wouldn't have changed anything. I did everything right from the beginning. And so we only scratch the surface by, well, I just want to do wellness blood work on my dog. Again, it's valuable. We look at the kidneys, we look at the liver, we look at cell counts, we look at trends, we look at electrolytes, we look at their proteins. It is so valuable. It also sometimes cannot tell the whole story. I've had dogs with beautiful blood work have very high levels of glyphosate, have mycotoxins, their guts are a wreck. Also, I've had dogs come to me that we had high liver values. They had done all the conventional testing, and we screened the dog, and the dog's got high levels of glyphosate. And I'm like, the liver is probably not very happy because it's having to take on this burden. The liver is a detox organ. And so when we only scratch the surface, we only get surface level results. We only get surface level recommendations. We don't have the whole picture. It's like trying to make a cake, but only wanting to use eggs and flour. You're not going to make the whole cake. You don't have everything you need to. And how nice is it to have some test results come back normal and have that off the radar, and to know that's not a contributing factor, rather than we're still guessing. It's like walking into a room and the lights are off, and you've done, let's say, 2 tests. You've done intolerance and microbiome. So I've removed the blindfold, but I'm telling you to still keep your eyes closed and to keep reaching. So maybe now you can see the shadows of light coming in from the windows, but you still don't have the full picture. And so when we don't really get to the root cause, and yes, sometimes I understand pet parents are like, hey, let me do 2 or 3 tests. This is in my budget right now. In a month, I'll do 2 more. Great. But I think it is also very naive, innocently, to say, well, my pet doesn't have X, Y, and Z. But how do you know? How do you know? You don't know. I don't know. I've had test results come back that I'm surprised for the good. And I've had test results come back and I'm surprised for that. I've had tests for pets come back that they have very high levels of nickel. I've had pets come back with very high levels of mercury. I've had pets come back with very high levels of strontium. I've had pets come back with high levels of boron. I've had pets come back with high levels of mycotoxins. I've had pets come back with glyphosate, and another test is normal. Or their microbiome isn't quite healthy, but they've got these other toxins in there. And so we have to look at the whole picture. And so if you want your pet's health to be elevated, to maybe get off the medications, or to lessen the medications, or to just figure out why their poop just can't stay consistently normal, or why they just can't stop scratching. And as soon as you give the medications, it works and then it stops working. We need to figure out what is going on under the hood. We need to kind of pop it and figure out what's going on, rather than just guessing and scratching the surface level. When we only do microbiome, or we only do intolerance, or we only do 1 toxin test, yes, that is valuable and it gives us a good idea. It does not give us all the information. And so we're scratching, we're getting a little bit closer, but really to peel back the layers of the onion, really to open up the curtain to get the whole picture. Imagine going to a show, a play, the Nutcracker, and they only open the curtain halfway. I don't know about you, but I wouldn't be happy that I paid for those tickets to see the show. That's what we're doing when we only do a certain amount of tests on your pet, when they're dealing with a condition. Or if you're the pet parent that is so proactive that you want to do it before there's an issue, having all of that information, so really we can really help set them up for success. Because remember, when we are only scratching the surface, we are only going to be able to help them surface level.